Hi guys, my name is Laura. I currently work in the NHS as a bed manager, which is a Band 7 role, and today I will try to give you some tips to help you with your interview for a Band 7 position. For a senior position, when you are called for an interview, you will be asked questions by a panel, but you shouldn't assume that the panel have knowledge in your specialty. So you always need to use specific examples from your experience to support all of your answers, even if you know the interviewers. So, what type of questions should you expect in your interview? It should be a combination of traditional and competency-based questions. And through those questions, they will be exploring your skills, qualifications, and experience. While normally clinical skills are explored via a written test before your interview, they may put you on the spot in the interview, so better be prepared just in case. I have organized a normal interview in 5 main types of questions you might be asked. I will explain what the panel is looking for on each question, how to prepare them, and an example of each type. Number 1. Questions about professional values and ethics. What the panel wants to find out through these questions is your ability to stick to the NMC code and the NHS values. How to prepare them? Simply read, understand, and practice how to apply the NMC and the NHS core values on the day-to-day situations. One example question could be, provide an example where a staff member was underperforming in their role and how did you deal with the situation. Usually, there are 2 angles that may need to be covered depending on the role. If it's more clinical and the underperformance of the staff is linked to the quality of care, you would need to demonstrate your knowledge of formal disciplinary procedures. Or if your role isn't clinical, then through your answer, you need to demonstrate that you're not coming down hard on your staff. Instead, you should show that you are going to work with them to support them in getting back on track. Number 2, questions about your previous experience. The interviewer will ask questions based on your experience as is shown on your CV. For a senior position like a Band 7, they will explore your ability to manage a team, delegate tasks, and take on more responsibility. How to prepare these questions? For example, shadowing your current manager, involving yourself on the risk assessment, and following as well the action plans. I think the best person to ask about it is your matron or your head of nursing, especially if they might be on the panel. Showing interest is just gonna add you some extra points. And a question could be, how did you manage conflict between 2 staff members on the ward? We need to give an answer explaining that when dealing with any form of conflict, the priority is to resolve it with confidence, quickly, and take the necessary steps to ensure it doesn't happen again. Your answer could be, I first tried to find out why the conflict was happening, and I spoke to the 2 members of the staff to establish the cause. Then I encouraged them to resolve the conflict themselves in a professional way. And I explained that unless it was resolved quickly, I would step in and facilitate the resolution myself. In your answers, I would highlight that it's not acceptable to allow patient care to be affected by the team. Number 3, questions about your training and qualifications. This category is all about questions exploring your understanding of governance, clinical effectiveness, NHS and trust targets, as well as your ability to keep your skills and knowledge up to date. This type of questions focuses as well on how you have contributed to improve a service. How to prepare? You should do your research prior to the interview. Read all the SOPs of the department you are applying for. Talk with the doctors of the specialty and find out about the newest interventions and try to read about them. Find out how you could improve the department you are applying for. A question could be, give us an example of a service or a process which you have improved and how did you successfully manage to do it. You could answer this question using the STAR techniques: situation, task, action, result, so you can demonstrate certain attributes. In particular, they are looking for someone that is proactive, innovative, resourceful, as well as having a continuous improvement mindset. NHS interviewing scoring system will score highly within the interview if you mention this in your answers. Number 4, questions about core competencies. These questions are required to see if you have the key skills and aptitudes required for the job you are applying for. Prepare competency-based interview questions and make sure you demonstrate the following core competencies when you answer. Communication skills, leadership, developing yourself and others, health, safety and security, decision-making and problem-solving, quality of care, teamwork, and let's make an example question of the last one, equality and diversity. Imagine this question. Provide an example of your contribution to diversity, inclusivity, and equality in the workplace. The NHS takes equality and diversity seriously, particularly when it comes to patient care and co-workers. Give an example, because there are many cases that you have taken equality and diversity into consideration and you haven't even noticed. For example, did you provide extra support to a disabled patient or colleague? Or did you go out of your way to support someone who is hard of hearing or visually impaired? I'm sure you have. So there you have it. You have an example that you can use in your answer. Number 5, questions about personality, motivation, and coping skills. Basically, they look for your reasons for applying or for choosing your area of specialization and how well you deal with difficult situations. How you prepare it? Being honest and explaining your real reasons. It's also important to show the core values consideration when possible. This question is not always easy to answer. So what helps me is to record myself and hear me after, maybe with another colleague. One question example. Why have you decided to apply for this specific position and what value can you offer? Remember, the step up from band 6 to band 7 is usually substantial and your new role will be different to what you have done before. That's why the panel is trying to measure if you understand what is expected of you and how you can fulfill the responsibility. Talk about your motivations and reflect in this your understanding of what you will be doing. To finish, I would like to mention some key areas and hot topics because you should expect also questions exploring your understanding and your ability to apply guidelines in your daily practice. I suggest to be up to date into topics like COVID-19, infection prevention and control, duty of candor, mental health services, BAME, and many more. So prepare yourself and practice a lot. I know it's a lot of information, but don't worry, you don't have to remember all of it. This is just some of my thoughts of how I prepared my interview. And remember, the most important tip of all is to go with good energy and full confidence. Thank you so much for watching this video and I hope you find it helpful and good luck!